where I could stand in the middle of Fifth Avenue and shoot somebody and I wouldn't lose any voters, okay? It's like incredible.
But hundreds of millions of dollars are being funneled away from the Centers for Disease Control's Prevention and Public Health Fund.
We're prepared. We are really very highly prepared for anything.
And this week, President Trump signed a bill cutting $1.35 billion from the PPHF over the next 10 years.
And I like this stuff. You know, my uncle was a great person. He was at MIT. He taught at MIT for, I think, like a record number of years.
In addition, funding is not being renewed for global health initiatives, which monitor outbreaks overseas, including Ebola. So where does the CDC go from here?
Maybe I have a natural ability. Maybe I should have done that instead of running for president.
And what kind of programs does it support now that we might not be aware of?
Well, one of the biggest is actually immunizations, trying to create infrastructure and access to shots and vaccinations for many more people, children included, across the country.
And they're reliant on the vaccines that we will come up with. Very soon we're going to come up. Now, it takes a period of time to get them tested and then put into the market. It has to be very safe. You can't give a vaccine that's going to be unsafe. It would be a disaster.
This is in the middle of one of the worst flu epidemics that we've had. People certainly are conscious of vaccinations.
Obviously, you could logically say that if you had a process that was ongoing.
And also looking at diseases and other health issues that can be prevented.
And you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that.
That China has total respect for Donald Trump and for Donald Trump's very, very large brain.
The New York Times reported yesterday that you and other top officials wanted to recommend social and physical distancing guidelines to President Trump as far back as the third week of February. But the administration didn't announce such guidelines to the American public until March 16th, almost a month later. Why?
Donald Trump's very, very large brain.
You know, Jake, as I've said many times, we look at it from a pure health standpoint. We make a recommendation. Often the recommendation is taken. Sometimes it's not. But it is what it is. We are where we are right now.
And I like this stuff. You know, my uncle was a great person. He was at MIT. He taught at MIT for, I think, like a record number of years.
Do you think lives could have been saved if social distancing, physical distancing, stay-at-home measures had started third week of February instead of mid-March?
Where I could stand in the middle of Fifth Avenue and shoot somebody and I wouldn't lose any voters, okay? It's like incredible.
But you're right. I mean, obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
That China has total respect for Donald Trump and for Donald Trump's very, very large brain. Oh, China's so great. China's so great.
Tell us a little bit about the global health initiatives and
Donald Trump's very, very large brain.
Specifically, when we tackled Ebola, what was the infrastructure that we had in place and what's in danger now?
Right. So in terms of tackling Ebola, there was a supplemental aid package that was passed to try to help build infrastructure in countries to tamp down the outbreak and actually prevent future outbreaks. And
I like this stuff. I really get it. People are surprised that I understand it. Every one of these doctors said, how do you know so much about this?
And so now what's happening with cutting that funding is that it's actually creating more of a risk in the future. If there's another outbreak, then we don't have that infrastructure to prevent the outbreak from spreading.
You said that you don't take responsibility, but you did disband the White House Pandemic Office, and the officials that were working in that office left this administration abruptly.
You know, my uncle was a great person. He was at MIT.
So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question. Where I could stand in the middle of Fifth Avenue and shoot somebody and I wouldn't lose any voters, okay? It's like incredible. And rather than spending the money, and I'm a business person, I don't like having thousands of people around when you don't need them. I mean, you say we did that. I don't know anything about it.
You don't know about the reorganization that happened at the National Security Council.
It's the administration. Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
Former CDC Director Tom Frieden outlines his concerns in a new op-ed for Time magazine. He says the agency he led for 8 years now faces unprecedented and potentially catastrophic cuts.
Is with us now from Washington. Doctor, the Trump budget proposal calls for reforms to the CDC through a new $500 million block grant awarded to the states. Now, in your piece for Time, you say that these block grants are just bad government. Can you explain why you feel this way?
That China has total respect for Donald Trump and for Donald Trump's very, very large brain.
But in addition to the amount of money provided for protection, there's also how it's provided. Block grants basically send a blank check to the states and say, use it how you see fit. That may be good policy for some parts of government. For public health, it's really bad government. You cannot give guidance. You cannot make sure that the programs that are implemented are the ones that work. You can't make sure that the states don't use it to replace their own money. You can't hold them accountable. It's not being diligent stewards of the money that is entrusted in CDC. So a block grant really undermines accountability and it undermines effectiveness.
Yeah, please.
Some of the governors are not appreciative of what the federal government's done, and you've suggested that some of these governors are not doing everything they need to do, like that these governors are at fault. Can you be specific? What more in this time of
Well, I think we've done a great job for the state of Washington, and I think the governor, who's a failed presidential candidate, as you know, he leveled out at zero in the polls. He's constantly tripping and I guess complaining would be a nice way of saying it. Michigan, all she does is she has no idea what's going on, and all she does is say, oh, it's the federal government's fault.
You know, you also remind people about the emergence of tuberculosis in the 80s, a particularly strong strain. And you say that it was a direct result of these sort of policies, these block grant policies. You're worried that moving forward, we could see something similar happen.
Absolutely. In the 1980s, tuberculosis control was put into a block grant, then it was cut, then tuberculosis came roaring back in drug-resistant forms that ended up costing this country more than $1 billion in hospital and other care. Similarly, right now, CDC has very important programs that help states and communities prevent outbreaks in hospitals or from food sources or address our leading causes of illness and disability and death. If those programs are cut and made less effective, not only will it cost lives, it will cost us money.
Where I could stand in the middle of Fifth Avenue and shoot somebody and I wouldn't lose any voters, okay? It's like incredible.
In contrast, in public health, it can take many months for us to get the resources and the permissions or authorities to act in an emergency. It's very important that Congress make an emergency fund available and that it's able to be used efficiently. That way we can stop an outbreak when it first starts before it becomes an epidemic.
And they're reliant on the vaccines that we will come up with. Very soon we're going to come up. Now it takes a period of time to get them tested and then put into the market. Yeah, it has to be very safe. You can't give a vaccine that's going to be unsafe. It would be a disaster. When somebody, for political reasons, wants to blame, I view that as blaming these incredible people.